so I usually don't need a microphone. Can everyone hear me okay? All right, great. Ron's giving me the thumbs up from the back row back there.
That's thumbs up. I just thought that might be loud.
No, okay.
Thumbs up.
Great,
Thumbs up.
Well, like Brian said, I think I bleed Baxter blue at this point. I've been here for so long, and I know that I probably recognize the majority of folks, and I've met some new friends this morning from anesthesiology, so welcome, girls. And I'm just excited to talk to you a little bit about what our program has expanded to at the Reppell Clinic, and just get started here, I guess. Feel free to ask questions. I'm pretty open, I teach classes all the time, so whatever you guys feel comfortable doing. My office is located on the main campus here in Mountain Home. We are directly across the street from the emergency room entrance at the hospital. We share parking with the emergency room. And we used to be affiliated with our community support houses. And so we're just kind of nestled in between Heights Cancer Support House and the Muruck Family Center on Aging. But our beautiful little building there just is very inviting and very welcoming. And we're there Monday through Friday. We are open from 8 to 5, closed at noon on Friday. Our clinic still continues to offer a lot of the same services that most of you have been referring to for many years. So I'll talk to that at the end of the presentation, but I wanted to share with you a couple of newer things. This is our classroom setting and how we teach our diabetes classes in the picture there. But some of our newer services are helping your patients with continuous glucose monitoring. I know that has been a huge, huge blessing to most of us for diabetes management in the last probably 5 years. And I am very, very, very proud to see my patients coming in and wearing their monitors and being proud of themselves for monitoring their blood glucose, so I love that. We are still helping your patients with those devices. How many of you have given somebody a continuous glucose monitoring system at your clinic? Yay, good for you, woo! Makes me so happy. And sometimes I find that they have a little bit of trouble setting them up, or maybe getting them affiliated with their cell phone. So myself and my nurse at the clinic are there and available to help the patients with that as well. We call ourselves the Diabetes Tech Support Team now because that's kind of what we do sometimes. Also assisting with some of those referrals. I know that getting those devices covered is a challenge at some level, and glad to know that Medicare is now covering them for our insulin-dependent patients. So it's very important if a patient needs a continuous glucose monitor that we're able to get one for them, get it up and running, and then get them some continued supplies on down the road as well. What about pumps? Anybody like an insulin pump? Oh, come on now. I got one guy. I love it. One of my favorite things to train a patient on is how to use their insulin pump. I've been a certified pump trainer for about 10 years now with Omnipod and Tandem. We're working on our Beta Bionic contract as well for our clinic. And what that means is if you think a patient is appropriate for an insulin pump, or if they've just exhausted all their efforts in trying to manage their diabetes and you feel like, you know, I think it's time, send them over. We're glad to help them pick out a pump. We're glad to help them kind of peruse and shop for one and find one that will be appropriate for their use. And one of the other cool things, and I put some out at your table, so I told Dr. Stevens, when you get bored listening to me talk, you can play with the toys that I put out. One of the things that I have discovered is an insulin delivery device called the C-Cure. And I know that most of you struggle with basal bolus insulin, getting your patients to take their bolus doses. It's pretty easy to talk somebody into taking one shot a day, but once you get beyond that, those multiple daily injections get a little bit more intense. And so we found that with the insulin delivery device, it's not a pump, it's not giving them insulin continuously, but it helps them give those bolus doses. So we're happy to train and help them get set up on one of those devices as well. And then one of my proudest, I guess, or most recent offerings at the clinic is some diabetic peripheral neuropathy treatment called Qutenza. It's an 8% capsaicin patch, and we'll talk a little bit about that in a few moments. It's applied directly to the patient's feet to help them with that peripheral neuropathy. So when they're not ready to go see Dr. Kraft, where did he go? Yeah, for pain management, or maybe they're already seeing you, we can help hopefully bridge that gap a little bit more even. There's just, you know, as you all well know, not a ton of great treatments for diabetic peripheral neuropathy out there. So we're glad to offer that in our little clinic as well. Still doing our classes, still doing our support groups, still taking the diabetes kids all over town and doing crazy stuff with them. We still have our free glucometers for handout. Anybody, anywhere can come by and pick up a monitor. We want patients to be able to have access to all of those services. And we're still doing our cooking classes as well, so a lot of our patients really enjoy that. These are the continuous glucose monitors that we oftentimes utilize, Dexcom G6 and G7, Libre 2 and Libre 3. All of these are considered continuous, although the Libre 2 is more of a flash glucose reader. As most of you know, they have to scan. So we're trying to get away from that so that it is a true continuous looping system. And even working on getting some of that embedded into the chronic care management portal as well. So hopefully that will continue to get better and grow in services. Love CGMs. Again, probably one of my favorite things to talk about and to present on and talk to our patients about. It's a life changer. It's a game changer for them, for real. Here's our pumps, the ones that we service in our clinic. Over to the very far side, you'll see the Omnipod system. And then right next door to that, the tandem with the G6. Now we have tandem with the Dexcom 7. As I mentioned, the C-Cure earlier, this gives 2 units per click. So if you have a patient on sliding scale insulin, they pop this on, it holds 200 units, and they can wear it for up to 5 days, and they just click away. So you need 2 units, you take a click. You need 4, you take 2 clicks. Very easy, very simple for them to use, not techie. We're not having to deal with a lot of apps and things on their phones. So I find this is a really, really good option for our more mature patients that we serve here in Mountain Home. And then over to the very far bottom is our newest pump. This is the closed loop system, Beta Bionic. And this will be the first, or is the first bionic pancreas simulated type insulin pump. There's no carb counting with this pump. You put it on, the patient wears it for 7 days, and the algorithm begins to adjust the insulin as needed. So it's very, very, very patient friendly. I'm really pleased with all of these pump systems so far. I've been working with them for several years now. They're very safe, and for those of you that are a little hesitant about insulin pumps, your patients actually have less hypoglycemia on a pump than they do on basal bolus insulin. So just keep that in mind. If you have somebody that's really struggling, let us know. We're glad to help with those types of things that maybe your office doesn't have as much time for, or that would be of some adjunct therapy to what you're already doing with your patients. I tell my patients, I'm not trying to be your primary care doctor. Trust me, I love you, but you got to have a primary care doctor because I don't want to, you know, look at all your sore throats and stuff. They think that's pretty funny. Here's some examples of some pumps and CGM trainings. These are mostly some of my kiddos. I think that speaks for themselves, the pictures. And then onto the Qutenza therapy. One of the biggest things that I think has been so helpful with this is that it is a targeted therapy to the actual site of pain, if you will. So the capsaicin, as most of you probably are familiar with, the over-the-counter stuff is about 0.25%. Police grade pepper spray is 1 to 2%. This is 8%. So it is very powerful. I have to put on the whole, you know, gear to put it on these patients, and we have to be very careful that it doesn't aerolize in the room and get into people's nose and eyes. But it works, and it does do a pretty good job. Most patients experience about a 30% decrease in pain after the first application. So it's pretty legit. It does work by chemical ablation of those nerve fibers. It's about a 3-month treatment, so we can do this every 91 days for patients. And it has been indicated at this point for diabetic peripheral neuropathy and post-herpetic neuropathy. I did have a little video, but I think I'm out of time, so I was afraid I would get real nervous and just want to play the video for y'all. But if you want to see the video, check out their website. There's some different handouts and things on your table. This just kind of gives you an idea of what it looks like going on. It's just right on the feet. And again, sustained pain relief. It's pretty amazing. Our first patient that we actually offered the treatment to was one of our volunteers, Mr. Paul. And when I say this man's a rocket scientist, I truly mean that. He worked for NASA, so he's a very smart, very sharp gentleman. Comes to my office once a week to volunteer. I love him. And he's had trouble with neuropathy for years and been falling and having other issues. And I said, hey, Paul, why don't you try this? and he's now had his 3rd treatment, and he said his feet have never felt better. So it's really a great product, and I'm very excited that we've been able to start that service line as well. There's a little bit of insurance checking that we have to do through the Qutenza. So if you have a patient that's interested or you think that would be good for them, let us know. We'll see the patient, go ahead and start checking and verifying their benefits. And then finally, an example of our support groups. As I mentioned, we're still doing all the fun things over at Reppell and still taking the kids on all kinds of fun outings. As you can see, yes, they talked me into going to the trampoline park. Lord help me, I did not feel good the next day. But that's what the kids need, is they need that support. And big thanks to Barney, who started this program years ago with the community support and outreach, and we've just been able to continue that throughout the years. So I live in the best of both worlds, the community support and the clinic, and I love my job and I love working with you guys, so thank you so much. If there's any questions or concerns, please let me know. Shoot me a text, email me, whatever. Just here to help and happy to be a part of your team with the community health. So thank you.